Well, the situation is extremely bad. So many people are dying. Funeral homes are overwhelmed. We've gotten to that situation now where it's in your house. Every Zimbabwean is getting to that situation where you know someone who has died of COVID, or you have been a victim. I myself just lost literally a brother-in-law on New Year's Eve, and we buried him on the 2nd of January 2021. So it's quite bad, and it exposes the leadership crisis in this country. It exposes the lack of readiness by the regime. It exposes the lack of craft competence by the regime. For literally 6 months since March, we had survived by the grace of God. Very few people had died. Very few people had been affected. Now we are in this wave now. Now we are in this avalanche. And of course, the government has been caught with its pants down, literally and metaphorically. So the situation is extremely bad, and it's compounded by the fact that we've got an illegitimate, clueless government that is in charge.
Is it possible to even get hard figures? I mean, are people in Zimbabwe actually being tested for COVID-19?
Look, you can't get a hospital bed. Some of the people who died last week were actually prominent business people who had the means to afford hospital beds, but they couldn't get any hospital beds anyway. So even in the hospitals themselves, the public hospitals, nurses are not coming to work because there's no PPEs. So you find a situation where those who can afford are flying themselves out. Some are even buying, through private means, ventilation machines. So the situation is extremely tenuous. It's reflective of a failed state. It's reflective of vulnerability. It's reflective of fragility. Mr. Mnangagwa's government is not equal to the task that is at hand. In fact, ironically, Mnangagwa himself is actually on leave, and you have got his vice president, a general who is posing as a minister of health. He has no qualification in medicine. So cluelessness, lack of leadership is what is going to kill Zimbabweans more than COVID itself.
Do you support then this move to have a tighter lockdown? I mean, I appreciate your criticism of your government. You're a member of an opposition party, but a lockdown is a big issue. It's a complicated thing. Do you believe that Zimbabwe should have the tight lockdown it currently has?
I don't agree with the lockdown that they imposed. You cannot impose a lockdown for the sake of a lockdown. When you impose a lockdown, there must be sufficient measures you are taking to ensure that you actually flatten the curve and you contain the disease. So for starters, it's foolhardy to impose a lockdown when people are starving, when people don't have jobs. 95% of Zimbabweans are unemployed. So you can't impose a lockdown when you don't have social safety nets, when you don't have grants that you are giving to citizens. Citizens will just go back in the streets to eke out a living. You can't impose a lockdown when your borders are open. Zimbabwe's airlines, there's freedom of movement into Zimbabwe. The airways are open. There ought to have been international travel restrictions. Thirdly, you can't impose a lockdown if you are not testing, if you are not unleashing a serious program of mass testing and mass isolation. Fourth, you can't impose a lockdown when, unlike other countries who are already rolling out the vaccines, you are not doing that. Fifthly, you can't impose a lockdown when there are no PPEs in hospitals, when hospital staff is not there because you're not paying them well. So the lockdown is just a way of repressing and closing a political space. In particular, the lockdown is targeted at repression of alternative opinion. So it's a crackdown, it's a de facto imposition of the state of emergency.
What's the food situation like in Zimbabwe? I know that various bodies, Human Rights Watch, have said there isn't enough food, there isn't enough money for people to buy food in Zimbabwe. Are people actually able to get food in your country?
So we have a humanitarian crisis acknowledged by the UN, acknowledged by all the aid agencies. By August of 2020, 10 million Zimbabweans were food hungry. Now we are having some decent rains that will mitigate the situation a bit, particularly as we approach harvesting season around March and April of 2021. But the fact of the matter is that the majority of Zimbabweans, particularly in urban areas, have been plunged into poverty. 79% of Zimbabweans are now living in extreme poverty, surviving on less than US $1.25 a day. Even for those that can afford, food is there in the supermarkets, but with 95% unemployed, the no one is moving the food. So we really need an economic upstart. We really need the humanitarian assistance from the international community. Most importantly, we need a political solution. President Ramaphosa must intervene. SADC must intervene. The African Union must intervene to create a lasting solution in Zimbabwe, because the ordinary average Zimbabwean is carrying the burden of illegitimacy imposed by the coup of November 2017 and the stolen election of July 2018.
You say our President Cyril Ramaphosa must intervene. What do you want him to actually do? I mean, what do you think he or the African Union could do?
He doesn't have to reinvent the wheel. You recall that under President Thabo Mbeki in March of 2007, SADC convened an extraordinary summit in Dar es Salaam and gave President Thabo Mbeki the mandate to find a political solution in Zimbabwe. SADC must intervene and give Ramaphosa the mandate to intervene in Zimbabwe and find a political solution amongst the contested parties. It is important to resolve the crisis of legitimacy. It is important to create a soft landing for Zimbabwe to avoid an implosion or another military coup. It's important for SADC to act before there's an implosion.
You say that, but I mean, your government, the Zimbabwean government, won't accept that, surely. It's very difficult for any other country to intervene.
International law imposes a duty to act. And for President Ramaphosa and for any South African to think that there is no crisis in Zimbabwe, just look at the Bide Bridge. Bide Bridge is a macrocosm of the implosion that Zimbabwe is. Thousands and thousands of Zimbabweans are stranded at Bide Bridge trying to enter into South Africa. And South Africa, for all intents and purposes, is now subsidizing the Zimbabwean crisis. 20% of the mothers giving birth at Baragwanath Hospital in Soweto are Zimbabweans. 1 in 3 waiters in South Africa is a Zimbabwean. So South Africa is carrying the burden of illegitimacy too. Therefore, the obligation to resolve the Zimbabwean crisis, because to South Africans, Zimbabwe is not a foreign policy issue. We are a domestic issue. We are in your restaurants. We are in your gas stations. We are in your kitchens. We are in your bedrooms. And yes, we are in your prisons. So it's important for South Africa to provide the leadership in the name of Pan-African solidarity that is required to resolve the Zimbabwean crisis once and for all.
Tendai Biti, I really do appreciate the time.